Welcome to Deuk Spine Institute, Surgery Center Vieira. We are broadcasting live spine surgery. Our patient is here with primarily pinched nerves going down into his left leg. He's having weakness, it's getting worse. He's had surgery. Yeah. He's had multiple surgeries. If you look at his back, you'll see it, but I don't want to scare you. Thank you. Shot. All right, so we've got to try to get into 3 discs here. I don't think I can get 4 with this one incision, but we'll try our best. He's had surgery elsewhere. I won't say the name of the place, but he's had 16 back surgeries. And you can see all the cuts. There. You all see that? There's some hidden.
Yes, we do.
Unfortunately, he's a victim of, in my opinion, some bad surgery. 5, 4, 3, 2, 2, 3, 2, 3, 3, 4, 4, 5, 5, 1. All right. I'm going to try to get the 2, 3, and 3, 4 at least with this one. Shot. He's got a deep back. I feel the scar tissue right now. Tons and tons of scar tissue from the 16 back surgeries he had. And I'll just give you a hint. The place he had them done was over in Florida on the other coast. AP, not going to mention any names, but it starts with a B. And they're located in, what's the name of that place? North of Tampa. No. What is the name of it? Huh? No, I can't remember. Man, there is a lot of scar tissue. I'm going to have to go around. Shot. And his spine is very deep, by the way. So, unfortunately, with 16 back surgeries, it makes it my job a bit harder. Are you comfy? Shot. AP. So normally you'd be right at the disc there because we're at the mid-pedicular line. I think we need to be a little bit more lateral. The problem is the normal landmarks that normally I would feel here, I can't feel them because the bone has been removed. Shot. Are you comfy? AP, is he reliable?
How are you doing, my friend? You okay? How are you doing, all right? You okay?
That looks pretty damn good.
He needs another minute.
Yeah, no worries.
We have to give him a little, keep him comfortable.
Yeah. Well, I could feel the herniation there. Shot? That is no fun. 16 back surgeries, folks. 16. Ugh. Hard as a rock. Where are you feeling pain?
Where are you feeling that, my friend? In front of your back? His back.
Question is, what do I got to do to get to 2, 3? I feel like I need to be a little more medial and superior.
Deep breath. You're doing great.
You're doing great.
Doing really well.
I'm going to go ahead and do a separate incision for 2, 3. You're doing great. Just lay still, okay? I need your help here. Shot. I need your help. You're doing good. All right. AP. So part of the problem is the last surgeon that did 16 back surgeries on him took out a lot of the bones out of his back. The bones that I need to guide me. And now I have to work in areas that are full of scar tissue rather than bone, normal bone, because the surgeon took all the bone out. So it makes the surgery a lot harder to do. Lay still. Shot. Where do you feel that?
You feel that in your back or your leg?
AP, you feel it in your back? Huh? I can't hear him.
Anywhere?
Nothing? You're doing great. Yeah, it's perfect. That is
Keep
perfect.
your head really still, my friend, or else everything's going to come off you.
Just lay still. You're doing good.
Nice and still in your head position.
Yeah. We're into the 2-3. We're good. 2-3 is good. 3-4, we're there. Shot. He's just so thick. It's really hard to see. You comfy?
Yep.
All right. You're doing really good, by the way. Better than I expected. But you got a lot of bone in there from your prior surgeries. Yeah. I'm not going to be able to get into that. I'll try a little bit more, see what we can do. So he has, how long have you had your back and leg pain? Huh? Oh, when did it all start? How many years ago? How many years ago? Huh? 2.5 years? But you didn't have 16 back surgeries in 2.5 years, right?
Yeah.
You did?
Oh, yeah. Oh, yeah. So he told me.
Wow. All right. It's all right. We still love you. All right. Henry, we're live, right?
Of course.
Yeah. So if you have questions, folks, during the surgery, please ask. But yes, he really has had a lot of back surgery. And not just back surgery, but he's had some complications from the back surgeries, right? DVT? No? Just lay still. You're doing really good. Everything's going pretty well for you here. Shot? Let's keep it that way. All right. Just lay still. All right. I feel the bone. Huh? Everything all right?
Yeah, I'm just putting it back here. There you go. I need you to move this back like that. Put your head on this thing, rest your forehead on.
So why do people get back pain from a disc problem? Henry, show our audience why they get back pain from a disc problem. Meanwhile, we're going to keep working on getting these needles into place. AP. All right, welcome back. So you see why discs actually can cause so much pain. Turns out that the disc is the cause of chronic back pain in 85% of patients, the main cause. That said, we are basically in position, not able to do 5-1. We don't need to either. It's too collapsed. But we are going to get into 3-4, 4-5, but we're going to have to do that when he's more asleep because he's tightening down. And I can't get past the bone spurs. So we are going to test one disc, and then we're going to put him to sleep, and we're going to move on with the procedure. Are you comfortable? So he's had, I'm going to show you his prior incisions. Just lay still. You're doing great. We're going to have you asleep in a minute. He got a cut here from his microdiscectomy, another microdiscectomy, another microdiscectomy, another microdiscectomy, another, and another. Yeah. And it was all done, 16 back surgeries in Hudson, Florida. That's where it is. You comfy? How bad does that hurt on a scale of 1 to 10? Huh?
6.
The highest it goes is 6? Is that where you get your back pain? Yes? All right, we're going to put you to sleep. When you wake up, we'll be done with your surgery, okay? You did great.
You did really well.
So he had a discogram at 2-3, and he had 6/10 concordant. He's a pretty tough guy. He's been through a lot. 6/10 concordant. I couldn't test the other levels. The other thing he has, folks, is he's got pain right here and right here. I just talked to him about it. We call that facet joint pain. So his problems are coming from discs that are herniated back, pinching the nerves, causing weakness in his left leg. We're going to go unpinch those nerves. He's also got facet joint pain. We're going to treat that with our Deuk plasma rhizotomy. We're going to start by doing the L2-3. That's the one disc that I was able to get into easiest shot. The other ones I'm stuck in the back because of bone spurs and collapsed disc. We're going to get to those next. If you have questions, feel free to ask.
No current questions, but we do have a comment and or seeking advice from Janet on Facebook.
Yep.
Janet said, my daughter-in-law's doctor is telling her she needs surgery. I tried to share a link of the picture and what they told her. I opened up the link myself, and it seemed to be a fusion. They said both sides of her vertebrae are cracked, and it looks like it is at the bottom of her spine and the coccyx area.
Yes.
They want to put metal in that part of her back. Yep. I'm trying to get her to consult with you before she does anything. She is supposed to get a copy of her MRI.
Yes, I appreciate that. So you're right. Fusion, it sounds like that's what they're going to recommend. I agree with the consultation. Our consultations are free. You can get answers. She probably does not need the fusion. Fusion is a knee-jerk reaction that all these doctors have. They want to just fuse because, number one, it pays them the highest amount of money. It makes good money for the hospital, the companies that sell the screws and rods. It's a very profitable procedure, but it's not good for the patient. It turns out fusions are not needed under those circumstances most of the time. So yes, we'll be happy to do a consultation. This patient's spine is so deep, way, way down in there. And yeah, we're having to max out the instruments because he's a big guy. Remember, he's had 16 or 15 back
16.
surgeries. 16 back surgeries by a spine surgeon, and I'm going to tell you, it's just shameful. You know, if we ever do 2 surgeries on a patient, it's unusual. Typically, we fix people with 1 surgery. Less than 1% of our patients need 2 surgeries. This patient's had 16. I could tell you he didn't need those surgeries. Shot? Yeah, I got this. You just take care of the pressure. He's got a lot of muscle. Muscle is what bleeds. Muscle's full of veins. Veins and arteries. Shot. So as we pass through the muscle fibers and spread them, we're going to inevitably tear some veins, and those veins are what bleed.
Also, he has more scar tissue.
Oh, he's got a ton of scar tissue from those 16 back surgeries he's had. Shot. So all that scar tissue, you guys see all these scars here from all the surgeries he's had. Those were not done at Deuk Spine. We don't do that to patients. Those are all microdiscectomies. Microdiscectomy. That's why microdiscectomy is a horrible surgery, folks. We don't recommend it. It's destructive. Let me work on that, please. You go do your other stuff. I got it. Don't worry. We don't recommend microdiscectomy. With microdiscectomy, the surgeon is drilling off your bone. Your ligaments are taken out, your bone is taken out, the ligaments are taken out, the facet joints taken out. It weakens your spine. This patient has had all that normal bone, normal ligaments taken out. It's weakened his spine. We're going to try our best to fix it now. I think we're going to be successful, but we'll see. Just leave it. All right, any questions?
No current question.
Irrigation.
No current questions. We just have another comment. This comes from Lisa B
Irrigation,
on
please.
YouTube.
All right, hold on a second. How come our irrigation is not flowing?
Is it on?
We have no irrigation.
That's all right there.
Huh?
So that's, yeah. Right now it's open.
Yeah, you're definitely not on. Yeah, you gotta know the truth rather than just guess, okay? We don't get successful results by guessing. All right. All right, we're working now. All right, yes, we have a question. Feel free to ask.
This comes from Lisa on YouTube,
Hi, Lisa. Welcome to our live stream.
saying, I've had 7 back surgeries in the with the last one being a complete reconstruction of the spine with 33 screws from
Oh,
my
wow.
neck to my rear.
So
And
sorry to hear that.
Now I'm leaning to the right and limping, and my left hip is higher.
Lisa, I'm so sorry to hear that. Really, I am. What can be done, right? So once you have the fusion, not much can be done in terms of the area where the fusion is. But we can get rid of pain if you're having pain. So if you're still suffering with pain, come to Deuk Spine. We can fix it. I just need to do a quick Zoom meeting with you, find out where your pain's coming from. And I need your MRI, and I need you to schedule a Zoom meeting. If you do that, I could figure out where your pain's coming from. But yes, it's very common for people to have big fusions because doctors love making those money. They love those fusions. That's where they make the most money. There is no medical treatment that pays a doctor more money than a spinal fusion, okay? So they're going to be recommending more and more of these for you people out there. As long as you're going to lay down and get it done, they'll recommend it. It's not in your best interest to have fusion done, okay? I used to do, I've done 1,000 fusions on the lower back. I've done 1,500 fusions on the neck. All I did was fusions because that's what I was taught to do. And I went to a top neurosurgery program for training. So I was taught to do fusions. Everybody in my program was taught to do fusions. We were taught to do fusions because that's all we knew how to do. Fusions and artificial discs. And artificial discs don't work that well. So we usually don't recommend it. But turns out there's a better way to fix backs, and it's endoscopic surgery. You're watching it right now. I can't get the message out fast enough. Unfortunately, a lot of patients just trust their surgeon for whatever reason, and their surgeon tells them you need a fusion or artificial disc or even a laminectomy. Laminectomy is a gateway drug. It's like marijuana. Once you start doing laminectomy and microdiscectomy, it's like smoking pot. You're going to be doing cocaine next, heroin, ecstasy, all the other drugs pretty soon, and then you're going to fuck your entire life up. So I'm trying to tell people, don't get laminectomy, don't get discectomy. This patient had 16 discectomies, okay? And now he's unfortunately living in pain with weakness in his legs because he went down that road of getting the discectomy and the laminectomy. I'm trying to tell people, avoid it. Avoid it like the plague. The surgeries we do at Deuk Spine are unlike discectomy and laminectomy. We're not taking bone out of your spine. We're not removing your ligaments that are there to stabilize your spine. Those surgeries, laminectomy and discectomy, they destabilize the spine. They make the spine weak. And then the doctor brings you back and says you need a fusion done. Well, of course you need a fusion done because they made you need a fusion by doing that laminectomy and discectomy. And of course, once you have a fusion, well, you're going to need more fusions. So we're trying to teach people the truth. Look at that tear right there. That is the annular tear. That's what we're here to fix. And we will. How are we going to fix it? The way you fix it, it's quite simple. You just clean it up. And by cleaning it up, the body will then heal it on its own. You don't actually close it up with a suture or metal pin or anything. Now, there's lots of companies out there that want to sell you things. They want to tell you they can close your tear, with a barricade device or with disc seal. But they don't work. That's the problem. They sound great. In theory, it's wonderful, right? It's like somebody selling you a vacation to Hawaii, and then you end up going there and you have to stay in a pig pen. It's not really a vacation. Sure, it's Hawaii, but the reality is that look at all that inflammatory tissue. See all that red, guys? Hey, that's a good one there, Henry, for granulation tissue. Get a picture of that. It's a good one.
Copy that.
Send it to me. It's another granulation picture. That's from inflammation. Did you get it?
Yes, I did.
Good. Yeah. That's what we're here to clean out. That's chronic inflammation. That's the body trying to heal this disc, this tear, unable to do so because there's pieces of this herniation here stuck in the tear, blocking the healing from happening. So what I was trying to say earlier is, do we have good irrigation? You sure? Because it's kind of sluggish. All right. No? Nope, nope. You're fine. All right, grab her. So I'm sorry that you've had so much surgery, but if you're in pain, we can help you. Okay? If you're in pain, we can help you. Just use our free MRI review link. Let me look at your MRI. Let me look at you. And I can tell you what's wrong and what needs to be done to fix your problem. If you're in pain.
They did add their, Lisa's in excruciating pain in the left hip and area and limping. And
I'm sorry to hear that.
she had her first 3 surgeries in Tennessee, where she lives, and the next 3 at John Hopkins, and the last big one was a 14-hour surgery at UVA.
Yeah. So John Hopkins is interesting. I'm not going to say anything bad about it, but when I was applying for my neurosurgery training, it was one of the top 10 neurosurgery programs in the country. And of course, neurosurgeons do brain surgery. We take out brain tumors in kids, adults. We put in shunts. We treat hydrocephalus. We treat nerve tumors. We treat trauma to the brain and spine. But really what a lot of people don't know is that neurosurgeons actually are the top spine surgeons in the world, the highest trained spine surgeons in the world. And Johns Hopkins was interesting. It was really an amazing program, steeped in culture, tradition. We call it the gentleman's program because they really treat the residents quite well. Anyway, Yeah, I met Ben Carson when I was there. He was still working at the time as a pediatric neurosurgeon. I interviewed with him. We had a good talk. Anyway, the thing about that actually scared me away from Hopkins was I asked them, like, what do they do most of their surgeries during the day? And I was told most of our surgeries are repeat spine surgery. Revision spine surgery, we call it. And I remember thinking, why would they have to repeat their spine surgeries, right? If you did it right the first time, you wouldn't have to be repeating it. So I ended up not going to Hopkins. I ended up going to UF Gainesville. Very good training. But I don't have anything bad to say about Hopkins except that they're doing the old-fashioned type surgeries that don't work, like fusions, laminectomies. And they're still not on the cutting edge. They're not doing endoscopic, transforaminal, laser surgery like we're doing here. They should be. All their surgeries should be what you're basically watching here, except for trauma, tumor, and infection. But they're really far behind. It's like so many other places. So, not impressed with Hopkins.
We have a couple more questions.
Yeah, so just one thing I want people to know, because I haven't said this in a long time. Deuk Spine Institute is capable of doing every surgery Johns Hopkins does. We have the equipment, we have the anesthesia, we have the implants, we've got everything. And I've done them all before, except we don't do them because we're doing a more advanced type surgery that Johns Hopkins doesn't know how to do yet. Johns Hopkins will probably be doing this surgery in anywhere between 5 to 20 years from now. Depends on, a lot of factors, but the most important is money. The surgeries Johns Hopkins does, like every other university hospital, they're really geared towards putting in as much metal into patients as they can. Putting in as many screws, as many rods, as many cages, as many artificial discs, because that's where the big money is. That's what they're after, is the big money. They're not really interested in doing the less invasive surgeries that work. Because after all, if the surgery works, then the patients don't go back for more surgery. And they want people coming back. Remember, the reason I didn't go to Johns Hopkins for my training was because they have so much repeat patients coming back. And I thought that's not a good thing. You should fix the patients right the first time so they don't keep coming back for spine surgery. Anyway, don't think that Deuk Spine can't do what other centers do. We've done that for years. Go back and look at our YouTube channel. We have complex spine fusions, reconstruction, screws, rods, cages, cervical, thoracic, lumbar, everything. All on our YouTube channel. And we do it all outpatient. So we do it better than Hopkins. Better than Hopkins, better than Mayo, better than Cleveland, if we're doing fusions. However, we try not to do fusions because they're so invasive and they have bad, unpredictable results. All right, go ahead, Henry.
This next one comes from Janet, once more on Facebook, following up with the surgeon and her daughter-in-law telling her about taking the fusion.
Yeah.
She said he told her that her back was probably like that since birth, so why do surgery now? He told her if she didn't have it done, she would lose feelings on her legs and feet. It's so unethical.
Well, yeah, so what's happening, just so you understand, is your surgeon is talking about the crack in your bone. All right? It's called your pars defect, P-A-R-S defect. Go ahead and type it up, Henry, pars defect. And we believe now, we've known this for 20 years, that the defect or crack in your bone is something you're probably born with, okay? But here's why we operate on it. We operate on it because in some patients, it gets worse over time and they get symptoms. But the surgeons wrongly ascribe patients' worsening symptoms to the crack. It's not from the crack that you're having your back pain. It's actually not even from the crack you're having your leg pain. Okay, the crack just happens to be something abnormal that they're seeing on your MRI or CAT scan or X-ray, and they've been told when you see that crack, go fuse it. But what we're learning now as doctors is that, and there's kind of a division here. Half of the spine surgeons say when you see that crack and the slippage, you need to fuse. The other half say you don't. So there's a division, okay? Now the half that say you don't need to fuse, they're not recommending the laser surgery because they don't even know how to do this. This is too advanced for them. They have no idea it exists. You understand? But what they're saying is you don't need a fusion. And they're right. Because there are patients who don't get fused and they do well. So there's a huge kind of disagreement, fight among spine surgeons. Half of them believe that when you have a pars defect, which you're born with, and you have a spondylolisthesis, that you should do a fusion. Maybe a decompression as well. The other half say, no, you don't need the fusion. And for me, I'm in the non-fusion group, but if you're going to do a laminectomy open and you're going to remove bone and ligament from the back of the spine, then you better do a fusion. If you're going to do the laser surgery that we're doing, you don't need a fusion because we're not taking any bone and ligament out of your spine. We're not weakening the spine. All right, so far good. Just about done. I'm actually outside the disc right now at L2-3 on the left. This is all scar tissue. And this is where the herniation is, right where my laser fiber is right now. You guys see that? I'm kind of sneaking in under the nerve root right here. It's not the exiting root. This is what we call the traversing root. It's the root that's going down to the next foramen. So if this is L2-3, that would be the L3 nerve root. And my only concern right now is, I know this was the worst level, is that I want to make sure I get any kind of herniation that may still be back here at the back of this disc, pinching on the nerve. Okay? I'm looking, I'm not seeing much there, but you know, part of being a surgeon, you have to sort of, I hate to say it, but you can't see 100% of what you're doing. Like I can't see the herniation, but it's right up there. There's a little bit left. I want to try to get all of it because I'm never going to get all of it, but if you try to get all of it, usually you get enough. So my philosophy is always do as much as you can safely so that you're not hurting the patient. If you have to hurt the patient and cause a complication, then you've done too much. So take it to the max, get as much as you can. Remember, if you watch my surgeries, I told you we're never going to get all of it. You're never going to get all of that herniation out, never. Doesn't matter what technique you use. This patient's had 16 microdiscectomies. 16, that's crazy. Why? Because he went to a surgeon who lied to him over in Hudson, Florida, whose name begins with a B. And the guy kept coming back because he got a little bit of relief. I can tell you why he got relief, because the surgeon tricked him. He put a steroid in there and he did a rhizotomy. So he got some relief, thought he was getting better, and somehow ended up getting 15 more surgeries. To me, that's insane. That's like going to a restaurant for dinner, ordering an entree, and still being hungry, and by the time you leave, you've had 16 entrees, right? You're supposed to order one and be full. It's the restaurant's responsibility to make sure you get enough food with one entree so you don't have to pay for 16. That's ridiculous. If I go to a restaurant where I order an entree and I can't be full, then I don't go back to that restaurant after one entree.
You ever go to Mia's in Orlando?
Mia? No. Hold on. All right, so let's take a look. There's the nerve root right there. That's the L2 nerve root. There's still a little bit of herniation right there I got to get rid of in the foramen. You guys see that right there?
Yes, we do.
And it's thick and hard, calcified. Yeah, fine. Yeah,
We have a couple more questions.
sure.
This next one, these next two
All right, that's good. Yep, go ahead.
These next two come from Juan on YouTube.
Hello, Juan.
Juan asked, first question, Dr. Deuk, question. I know you remove all the disc material touching nerves, but also in a foraminal stenosis, which I have, if those are bone spurs, could it be fixed? Doctors keep saying my spine is good.
Yeah, Juan, we can fix your bone spurs. These are bone spurs right here. That right there at the tip of the laser is a bone spur. I've already chipped it off with the laser, so it's gone. We fix bone spurs. If you need it done, I'll do it. But we don't do surgery just to remove bone spurs, because that doesn't do anything. The problem is never really the bone spur, it's the disc herniation and the annular tear. I used to think it was the bone spur, but then I learned after doing thousands of surgeries that if you don't, only a few of the bone spurs are actually a problem, strategically located ones. You take care of those, the patient gets great results. But you leave 90% of the bone spurs and the patient's fine. So there's a lot of misinformation out there about bone spurs, and the truth is, what you really want is you want to do an MRI review with me and get answers, okay? I give you 10 minutes. In 10 minutes, I know exactly what's wrong and how to fix it. Okay. Turns out that people with back pain, chronic back pain that's been there for more than 6 weeks, that the number one cause is a disc injury. And what I mean by a disc injury, I mean a herniated disc, a bulging disc, ruptured disc, protruding disc, extruded disc, prolapsed disc, slip disc. Any of those conditions are disc injury. Disc injury is the number one cause for chronic back pain. It accounts for 87%. So that means 9 out of 10 patients that have back pain, it's coming from 1 or 2 discs. Now we found out it's actually 2.2 discs. 2.2. So if you have back pain, there's a 90% chance it's coming from injured discs, and it's specifically on average 2.2 discs. Why is all that important, folks? Number one, the most important thing, it's important because, well, now we know what's causing pain, right?
Just took a deep.
Shot?
We're gonna
Huh?
get it. We're gonna get it.
Yeah, I'm not worried. I'm going to start with this one. So we know that all comers, just anybody with chronic back pain, 9 out of 10, it's the disc. And more importantly, shot, it's 2 or more discs. So if the doctor you go to only fixes 1 disc, which normally they don't even fix the disc, then you're still going to have pain. Hold that. Hold that. Yep. That's important, folks, because most surgeons only want to fix 1 disc at a time. If they're going to do a fusion, they're going to fuse 1 disc. Yet that means you're going to be back again because there's a second disc they're not fixing that's still hurting. Okay? 2.2 on average. We had a lot of patients. We did 500 patients. We studied 500 patients, all with chronic back pain. We just took 500, from the last 3 years that came here, just randomly selected, and we found that on average they had 2.2 discs causing their chronic pain. So I know out there surgeons, spine surgeons, are only fixing 1 disc at a time. And if that's the case, well, you're still going to have pain. Shot? That's important for patients to understand that. Who wants to go have back surgery and come out and still have pain and need a second surgery? But of course, they're going to put you through pain management, therapy, shots, medicine, all that first, right? Who wants that? Nobody wants that. Shot? So the reality is that we doctors as a whole are under-treating patients. We're not treating all the causes of their back pain. We're only treating one. And the insurance companies generally only pay for one treatment at a time. Sean? So people are getting hamstringed out there. They're actually getting the wrong thing treated often, and they're not getting enough of it treated.
Yeah.
Shot? All right, here we go. Nice. Yep, that went good. Hold on. Yep. All right, questions?
Yes, next question comes from Juan, once more on YouTube, asking if you remove all the items touching nerves at the end, like this patient with collapsed discs, the vertebrae will end fusing by themselves, right?
No. No, the vertebrae won't fuse by themselves. Because to have fusion, you must have no movement. Fusion will not occur as long as the vertebrae are moving. Now, why do doctors put screws and rods and a fusion? They put them there to get the bones to stop moving. You understand? If you hold the bones together, not moving them, for 3 months, they will fuse. So when you do this surgery and you clean everything out and there's no disc left, the bones don't fuse because you're not putting screws and rods or instrumentation. What happens is the bones move and they form basically collagen, which then just acts as a surface. Yeah, that's fine. Between the bones. So, yeah, again, like I said, there's a lot of misinformation out there. People think they know, but they don't. And they're being misinformed, by the way, by doctors, nurses, Google, whatever. If you're in pain or you know somebody that has back or neck pain, have them do our free MRI review. MRI.DeukSpine.com. It's the best thing you can do to get answers about what's causing your pain and how to fix it. By the way, if you watch our surgeries like this, you'll see we do these surgeries every single week, okay? And we do these surgeries every week because they work. Now, unfortunately, other doctors do surgeries every week because that's what they were told to do, even though they don't work. Because they believe it's okay to do surgery that doesn't work. You see, that's where we're different at Deuk Spine. We don't believe it's okay to do surgery that doesn't work. You know, it sounds crazy, doesn't it? That there are doctors that actually think it's all right to do treatments that don't work. But it happens all the time. You see, there's this belief that back pain is not fixable. There's a herniation. Look at that thing. Henry, get this. Let's get the light on. Check it out. You guys see this? It's not as big as last week. We had a huge herniation. Came out last week. But look at that herniation right there. You guys see it?
Yes, we do.
Yeah, last week we did, I think it was 1.5 inches. It went all the way to here. Yeah, that patient actually had a drop foot before surgery, and her strength is getting better now. All right, very good. Yeah, she had the prize for the biggest herniation we've taken out in a few years. I still remember the guy before her that had a huge herniation, but she beat him. I kind of keep a mental note of all these giant herniations. Anyway, that's what's pushing on the nerves. That's what causes weakness in the legs. These herniations. And they're firm, they're rubbery, they're hard. Everybody thinks a herniation is soft. It's not. By the time the hernia pushes on the nerve, it's actually very firm. It's got lots of scar tissue in it. All right, these grabbers just suck. You can see why I don't like the grabbers. They don't do very much. But when you get a big herniation, you need them to pull it out. Otherwise, you'd be lasering for an hour. breaking up the big herniation into little pieces. The laser is going to clean this out far faster than the grabbers. See that? It's already gone. Half of it. It's just floating.
We have a couple more questions.
Sure.
This next one comes from Deuce Volt MS on YouTube.
Hello, Deuce.
Saying, I had 2 surgeries on my back in 89 and in 95, a laminectomy. I seen a neurosurgeon last month. L5-S1 has done nothing in between the L5-S1 has nothing in between the disc, and he said something about fusion. I have 6 discs going bad. I asked him, if you fuse me, doesn't that put more pressure on the rest of the disc? He said that's a good question.
Yeah, it's not just a good question. The answer is yes. When you get a fusion, it's going to put a lot more stress on the disc above and below, as well as the facet joint above and below. And by the way, if it's L5-S1, then you're looking at basically your sacroiliac joints getting the next problem. A lot of people with fusion at L5-S1 end up with sacroiliac joint dysfunction. Look it up. SI joint dysfunction. By the way, we can fix that now at Deuk Spine permanently without fusion. So the doctor is going to fuse your L5-S1 if you let him, which I would not. Then you're going to go back and say, I'm still having pain. And he's going to say, oh, go to pain management, try some pills. You're going to get on narcotics, painkillers, probably get addicted, feel like shit on them. They're not going to fix your pain, of course. Of course, your pain's not coming from L5-S1 because he fused that. It's coming from L4-5 or L3-4 or even your SI joint, more likely. So then he's going to send you to pain management. You're going to get shots. 6 months are going to go by. The pain management doc's going to say, we could put a spinal cord stimulator in, or you can go see your surgeon. Your surgeon's going to say, oh yeah, we need to do another fusion. Then you'll have another fusion, then another, then another, then another, and it won't end. And then you'll get a spinal cord stimulator. My point is, it's a never-ending journey when you go down that road, okay? And it's not just about having a fusion. It's really about having bad treatment. That's what it comes down to. 99% of the people out there that have treatment and still have pain, they just had not really good treatment, okay? Now, I'll give it to you. The average patient with chronic back pain has about 4 things wrong, right? 4 areas that are causing pain. It could be 2 discs and 2 facet joints. It could be 2 discs and 2 SI joints. Point is, it's more than just one thing. And the doctor really needs to make the right diagnosis. Hello? Really needs to make the right diagnosis so that you can get the right treatment. We see a lot of patients are underdiagnosed. They have 4 things wrong when the doctor only treats 1. So of course the other 3 things are going to cause pain. What you got there? Just their lab book? All right. I didn't know it was that interesting.
This next question comes from Lisa, once more on YouTube, asking, does scar tissue grow back?
Does scar tissue grow back? The answer is usually yes, it does. That's why surgeons won't really do surgery for scar tissue, okay? But scar tissue also doesn't cause symptoms, usually. In other words, just the fact that you have scar tissue doesn't cause pain. It's actually something else causing your pain. The problem is a lot of doctors don't know how to figure out where the pain's coming from. So they tell patients it's scar tissue, just to get you guys to shut up and leave them alone. The reality is that there's something else causing the pain, and you need Deuk Spine Institute to help you figure out what it is. That's why we do the free MRI review, folks. The MRI review we offer is free. We don't charge you for it. We don't collect your information. We don't sell your information to advertisers. We don't care to do that. That's not why we're offering you a free MRI. We're offering people a free MRI for two reasons. Number one, they're not going to, a free MRI review, I should say. You're not going to get the answers elsewhere. So we want you to get answers. It's important that people have real answers that they can basically count on so they can make decisions about their health care, right? There's so much misinformation out there. We want you to have the right answers. Second of all, if you like us and you want to get fixed and we can fix you, well, then come and get fixed, right? So we want to help people by giving them the right diagnosis, but we also want to help people by fixing them the right way. So there's so many people out there that really don't know why they're in pain, and we can tell you why you're in pain. And we can tell you the best treatment available to fix your pain. We can even discuss treatments that your other doctor discussed with you. If your doctor tells you you need a laminectomy, we could tell you the pros and cons of a laminectomy, why you should or shouldn't get one done. Laminectomy is a very old surgery. It was the best we had many years ago, okay? You know, a long time ago, when people wanted to talk to each other, they would use something called a telegraph. You ever hear of a telegraph? Right? A telegraph. That's where they do the Morse code. Beep, 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 beep. And then you write down the beeps and what they mean. Then phones came along, and then eventually cell phones came along. The point is, communications have improved because of technology. The laminectomy is like a telegraph. As a matter of fact, the laminectomy was created around the same time the telegraph was created. It's that old, and there's been far greater advances. However, the doctors that are treating patients out there, many of them are not aware of those advances, so they're still doing the telegraph recommendation. Oh, you want a way to communicate with your family and friends? Buy a telegraph. No, you shouldn't listen to them. They're giving you old-fashioned advice that doesn't work. It's outdated. And a laminectomy is an outdated surgery. It should not be done anymore. It's too invasive and dangerous. Yet 95% of surgeons will recommend it because that's all they really know how to do. Or, more importantly, they know that you're going to get it done and you're going to be back asking for a fusion. And they want you to be asking for a fusion. Think about it. If you have 6 out of 10 pain in your back every day, you get a laminectomy, you're going to come back with 10 out of 10 pain every day. So if you're not convinced by your surgeon to get a fusion with 6 out of 10 pain, you sure as hell will be convinced to get their fusion with 10 out of 10 pain. And then once they fuse you, now that puts pressure on the other discs and joints. You're going to be back in 6 months to a year with more pain. You're going to be begging for another fusion. That's what they want, folks. That's why we're doing these broadcasts, to teach you guys this. It's the God's honest truth. And it's wrong. Back in the day when there was just a telegraph, fine, buy a telegraph to communicate. But nowadays we've got cell phones. So don't buy a telegraph. Buy a cell phone. Buy the best. You deserve it. You're worth it. That's what I tell people. May cost more money, but you're worth it. All right, questions. These are kind of bone spurs right here. Why am I getting water on my foot?
These next two questions come from Juan, once more on YouTube.
All right, Juan, sure.
First question.
Why not?
Hello, doctor. I sent my MRI a couple months.
My foot is freezing. What the fuck?
Can you check over there, down there, what's going on?
Sorry, go ahead.
Juan said, hello, doctor.
Hello, Juan.
I sent my MRI a couple months ago, and I will call back. How do you make sure a nerve is not damaged with the laser? I read a doctor that used an ultrasonic tool that won't damage any tissue.
Yeah, the ultrasonic tool does damage tissue. The ultrasonic tool damages bone. And that doctor is going to cut your lamina out and weaken your spine. That's Dr. Cantor you're talking about. And That technology is garbage. It's just a scam. We have ultrasound. I've used ultrasound in surgery many times. It doesn't work. It's just a gimmick to get people like you to go do it. How do we not damage the nerve? By being very careful. I'm a neurosurgeon. I don't know what Dr. Cantor is. I don't know if he's an orthopedic or a neuro. But neurosurgeons are trained not to damage nerves. Okay? Do you see a nerve here? No. The nerve is outside the tube. So the tube protects the nerve. You see that laser right there? That's 1 millimeter across. The ultrasonic device is 3 millimeters. This laser is far more precise than the ultrasonic device. And besides, if the ultrasonic device doesn't damage nerves directly, by removing the bones in your spine, it's going to cause your spine to crumble. And when your spine crumbles, it's going to damage nerves. So even though the ultrasonic device doesn't damage nerves itself, which is true, it will damage the nerves indirectly. I would not get that procedure done. I'll tell you right now, we have about $8 million worth of equipment and supplies here. The ultrasonic device costs $40,000. Do you think I could have an ultrasonic device if I wanted one? Of course I could. They're not like it's cost prohibitive. Ultrasonic devices are very cheap compared to other equipment. Lasers are $120,000 new. The ultrasonic device is $40,000 new. There's nothing special about the ultrasonic device except that he markets it as being better, which it's not. It's garbage. We have lots of his patients, by the way, that come here afterwards and get surgery here because his surgeries failed. Don't be a sucker. Deuk Spine does the best surgery. It doesn't do every surgery. We can do every surgery, but we don't believe ethically it's right to do every surgery because a lot of surgeries are garbage. They don't work. Just because a surgery has a name and can be done doesn't mean it should be done. There's a lot of bad surgery out there. We don't do bad surgery. We don't do bad surgery. We do the best. This is the best. There's a reason why other doctors can't do it. Technically, it's more advanced. They don't know how to do it. And it requires more sophisticated equipment than they have access to. Okay? There's nothing cheap about laser surgery. Ultrasonic surgery is very cheap and easy to do. What's the other question from Jose?
Juan asked.
Juan. Sorry.
No, it's all good. He asked how those the ultrasonic technology compares with the laser. I have disc bulge from L2 to L4, but I will push for my MRI review with you. Thank you so much.
Yeah, first of all, you can't push for the MRI review, my friend. You either send us your form filled out, you send us your MRI DICOM images, and the report. We need three things. The report, the MRI DICOM images, and you to fill out your form, okay? If you don't do all three, you're not getting an MRI review. So you don't have to push anything, you just have to push yourself to do what's right, not us. My team is very good. They will get you your MRI review once they have your form, report, DICOM images. And that's true for everybody. It doesn't matter if Donald Trump called up and said, hey, just do my MRI review. I don't have DICOM images. We'd say, sorry, can't do it. Okay? So, to get the MRI review, DICOM image, report, fill out the form, or you're not getting it. Second of all, how is the laser different than ultrasonic? Here's my advice. Go to the ultrasonic website and watch the surgery. See how he does it. Oh, wait a second. He doesn't put the surgeries on the website. He doesn't show you how he does it. He just shows you whatever he wants to show you. We show you the whole surgery for everybody because we're not trying to hide anything from you. Sorry you got to be the brunt of my joke today, but the reality is there's no comparison. That would be like saying, what's the difference between a piece of dog shit and a filet mignon steak? I mean, how do we even start, right? You could say, well, the dog shit has been eaten and processed. And then somebody may say, well, that's good. That makes it more digestible. No, wrong. So, it's a good question. But seriously, go ask Dr. Cantor to show you a whole surgery or two. We have 1,000 surgeries online. You can watch them. We do the surgery the same way, and we have great results for everybody. By the way, we looked at the outcomes for the surgery. 99.6% elimination of disc pain with this procedure. All right, we're pretty much done here. No. You got one more. I meant done with this disc. I apologize. Dr. Berndes got excited. Yeah. Yeah, I mean we're done with this disc. I like it. We're done. All right, so we're going to get this out. Scope off. Listen, people. There's a reason spine surgeons don't show you their surgeries. Because they're horrific to watch. They're invasive. There's bleeding like crazy. There's cutting your tissues, cutting your muscle, cutting your fascia, cutting your bone, removing your ligaments, cauterizing veins because they're bleeding. It's horrible to watch. They don't want you to see it. All they want you to see is a little cut on your skin where you say, oh, look how small it is. But what you don't realize is that a nuclear bomb went off inside your body. That's why those doctors give you oxycodone, Percocet, Dilaudid, hydromorphones after the surgery. Because the surgery causes so much damage to your body internally that you have to be on painkillers. Our patients don't take painkillers. We're not doing any internal damage. They have a little bit of bleeding, but minimal. We're not cutting the muscle, we're not cutting the fascia. With ultrasonic surgery, they're cutting your muscle, your fascia, your bone, removing your bone, removing your ligaments. It's, in my opinion, very invasive, very dangerous, and totally unnecessary danger. You don't need to be doing that to your body. All right, 2 down, 1 to go. Questions for me?
Next question comes from J Rock on YouTube,
J Rock.
asking, so what happens when you get the laser surgery on L5-S1, you get the left side and can't get into the right side? What's next?
Laser surgery, L5-S1, left side, can't get into the right side. Depends. I mean, it depends on how the patient does. If they're doing well, then you don't do anything. You leave them alone. On the other hand, if they need the right side done, then you got to go in and you got to take away the bone and ligaments and probably do a fusion. Hold this. That happens, by the way. We've had a few patients we're not able to get into a disc. And in all those patients, every single one of them, they've said, you know what, I'm doing great. I got no more back pain. I got no leg pain. And it turns out the reason why is because the reason I couldn't get in is that there's so much arthritis and bone there, it's holding everything together. So it's not moving. So they're actually not symptomatic from that disc. What happened to the other one? Huh? Oh, right. Yep, great question.
This next question comes from Ram on Facebook.
Yep.
Ram asked, Dr. Deuk, I'm sure you may have answered
John?
this question a million times, but I'll ask it again. Does the use of laser adversely impact the nerves or spinal cord?
No. Use of laser. Look, let me ask you a question, Rob. Does the use of a circular saw negatively impact the wood that you're cutting? Henry, you can answer.
Nope.
If I have a piece of 2x4 and I need to cut it, and I take a saw and I cut that wood, does it negatively impact the wood I'm cutting? Of course, it cuts the damn wood, but I want it to, right? But will it cut the person standing next to me? Will it cut my dog who's there at my feet sleeping? Will it cut my newborn baby sitting in a crib 500 feet away?
Nope.
But it could if I don't do it right. If I'm like, oh, look at my saw. Wow. Luis's head comes off. Ooh, I'm so sorry. Of course, you can screw a lot of things up with a laser. Just like you can screw a lot of things up with a saw if you don't use it properly. I hope that answers your question. Any tool can be dangerous if it's not used properly, including a laser. That's why you want to go to somebody like us at Deuk Spine, who does a lot of laser surgery. We have more experience with the laser in the spine than any other surgeon in the United States of America, and probably the world. Hold on. It's really not going in. You can see it's starting to split the bones apart, like spread the bones apart where the disc is. Yeah, you can see that white area. But it is super collapsed. I'll try. Man, it just sounds like, it doesn't sound right. Let's do this. I have concerns about getting this thing out. Let's go ahead and I'll get a little bit further and we'll put the tube in. Let's try putting the tube in. This isn't a back pain level anyway. This is more of a leg pain level, a leg weakness level. Let's go see what we can do. Remember, this guy's had 16 microdiscectomies, basically ultrasonic, banotic, whatever you want to call it, are all the same, okay? They're drilling away bones in the back of your spine. He's had 16. And we're now going through a natural opening in the spine. Here's the other thing. We're not taking any bone, any ligament. We're not creating any scar tissue. We're going through a natural opening in the side of the spine. Great question so far.
This next question comes from Samir on
A
YouTube.
little water. Yes, Samir.
Samir asked, Doc, how do you usually treat arthritis in the neck? I am currently having cracking sounds in the neck area sometimes.
Yeah, we don't treat arthritis for the sake of treating arthritis. We treat arthritis only when it's causing symptoms. The symptoms arthritis causes are pain in the joint, stiffness in the joint, and if there's a nerve getting pinched, the arthritis can actually pinch the nerve. That's what we treat. We don't just do surgery for cracking sounds. I would not recommend any treatment if all you have is cracking sounds. If you have pain with cracking sounds, then you should consider treatment. That's what we do. We fix that pain. Oh yeah, so we're right at the back of the disc. This is a collapsed disc. It's not just degenerated, but because he's had so much surgery on this disc by another surgeon, This disc is now fusing itself, okay? And that's because of the inflammation from those other surgeries. There's nothing I can do to stop that. Nobody can stop it. You cannot stop it. And you don't know that till you get in here. A lot of inflammation. You guys see the red stuff right there?
Yes, we do.
All that red stuff is the inflammation that is causing this disc to fuse. Now I'm going to try to get rid of some of these bone spurs and a little bit of disc material here, because this is right where the nerve is. It's just outside the tube. And the nerve is probably getting pinched by this junk. And I'm going to get rid of this arthritis junk, okay? These pieces just don't want to float out. They're making me stop and go in and grab them. They're not even that big. All right, look at all that scar tissue right there from chronic inflammation and surgery. Multiple surgeries. 16 back surgeries he's had, not here, elsewhere. I believe this will be the last back surgery he's ever going to need. Great questions, great audience engagement. Thank you.
This next question comes from Lisa, once more, on YouTube, asking, where is Deuk spine located, and also, does scar tissue grow back?
Yes, Lisa, Deuk Spine is located in Florida. We're near NASA. It's called Melbourne. We're in the Space Coast. And scar tissue can grow back. I'm not saying it will grow back, but it can grow back. Okay?
This next question comes from Ram, or Ram. I apologize if I mispronounced the name, but it comes from Facebook once more.
Awesome. Thank you. Ron from Facebook.
They ask, is the transforaminal approach better than interlaminar approach?
Yes. Yes, very good question. Transforaminal approach, which is what I'm doing today, and I always do, is far better than interlaminar. Interlaminar is more popular. More doctors do it because it's easier for them to do, but it's very bad for the patient. Interlaminar means you're going between the lamina, you're taking out part of the lamina, part of the ligament that's between the lamina. You're basically doing irreparable damage to the spine. You're weakening the patient's spine, you're removing ligament, you're removing bone, you're making the spine less stable during the surgery. That's the interlaminar. Now, what I do is a transforaminal, which is far better. Developed by Dr. Parvis Cambin in Pittsburgh. Look at that bone spur right there. That's crushing the nerve. The nerve is literally right above it. That's what we're here to remove. The interlaminar is a far more advanced technique. It's safer if you know what you're doing. It's better because you're not removing bone and ligaments from the patient, normal bone, normal ligament. And by the way, the transforaminal approach, like we're doing right now, takes you right to where the nerve is getting pinched, whereas the interlaminar does not. You have to retract the nerve root. It's a much worse surgery, but it's easier for surgeons. So that's why they promote it. I do not recommend it. All right, just about done here, and then we're going to move on to our Deuk plasma rhizotomy. Wow, huh? Look at that. That is all bone spur. We call that foraminal stenosis, lateral recess stenosis. What is it? We're almost done. We're almost done. Luis is the man. Great job, Henry. Any more questions?
Yes, these next two questions come from Chasin After Jason on YouTube.
Oh yeah, chasing after Jason. We like chasing after Jason.
Of course. Their first question, when I lay flat, my leg becomes numb. Pain starts throbbing in buttocks up to level 10. Piriformis or sciatica?
Yeah, great question, Jason after Jason. It's 100% not sciatica. Sciatica is pain down the leg. Pain in your buttock is most likely piriformis, or it could be facet pain, or it could be disc pain. You need a Deuk free MRI review so I could figure it out. Okay, set it up. Get it done. People, you're never going to get answers to your questions by just asking questions. You need a physical exam. I can't tell you how important and overstate the importance of a physical exam. There's the nerve right there. You guys see it? That's it. In its glory, right there. You're looking at it. Here, I'll poke it. Whoa. Poking it is not going to hurt it. Okay? That right at 12 o'clock, that right there is the nerve. That's the dura around the nerve. Notice how there's very little fat left in the foramen. That's because of the chronic stenosis. Okay? That is the nerve root. That, in this case, would be the L4 nerve root on the left. We are done. We've gotten the pressure off of the nerves. I've treated his discogenic symptoms. I've done everything I can. Now, will his MRI look normal? No, absolutely not. Far from normal. Remember, he's had 16 back surgeries. I'm going to show you his incisions, by the way, just so you guys can see what I'm talking about. Remember, he had his 16 back surgeries on the other side of Florida, over in Hudson, Florida, H-U-D-S-O-N. There's an institute over there that starts with a B, and that's who did 16 back surgeries on him. Oh yeah, by the way, they did lose temporary, get closed down. Apparently they had, in the news it said they had somebody operating over there that wasn't a licensed surgeon. Oh yeah. I mean, I'm laughing and I'm not laughing, if you know what I mean. If I didn't laugh, I'd be crying inside.
Yeah, we can.
There's a lot of scammers out there, folks. A lot of them are in South Florida. By the way, we are not in South Florida, for those of you wondering. We're in Central Florida. Central Florida is a different place. There's scammers here too, don't get me wrong, but not at Deuk's Spine. All right.
Better drivers here.
We have better drivers, less traffic. You know, man, I tell you, some of the craziest accidents I've seen down in Miami. It's unbelievable. Shot? We're moving on to the facet joint treatment. And the first one we're going to treat is we're going to do L4-5, L5-S1. Let's get some num-num. So we're moving from treating his pinched nerves causing his leg weakness. He has really bad leg weakness on the left with atrophy. And all those 16 surgeries, none of them fixed the problem. So we're going from treating his leg symptoms to treating his back pain. He's got facet joint pain. So we're going to go in and kill the pain nerves to the facet joints and hopefully cure his back pain permanently. That's our goal. That's what I expect to do here. He did have a little bit of discogenic back pain, but he was mostly a facet back pain. Turns out the facet joints are the cause of back pain, and well, about 44% of patients with chronic back pain have facet pain. Shot?
Yes. Slowly. Yeah. 1 second.
And by the way, his spine is super deep. I'm like touching it right now. Shot? You can feel it? And you guys can see that, right? Shot? That right there where the tip of that probe is. Show them? That's exactly where the pain nerve lives. Jordan, did you show them?
We saw it, yes.
Yeah. So I'm down there trying to burn that pain nerve. Shot. Perfect. That is exactly the spot. Right there. That area right there. Hopefully this works for him. It's called the medial branch of the dorsal ramus. For those of you scientifically inclined, inquiring minds want to know. It used to be a very popular commercial when I was a kid. Remember that one, Berndes? Inquiring minds want to know. I forgot what it was for. Jeez. Henry?
I
Any
have
idea?
I have no clue. I'm so sorry.
Well, type it in, Google, you know. Inquiring minds want to know. Man, I could literally feel that pain nerve right there. Incredible. Shot? So much scar tissue right around the nerves. Unreal. You doing all right? Okay, 2 more to go, we're done. Jordan, see if you can get L5 better for me. Shot? Uh-huh. Nope. Let's see. How about shot? Is that it? No. I need to be further south. How about that? That feels pretty good right there. Yeah, that looks good, huh, Jordan?
Yeah.
No? You don't seem convinced. Shot? I think that right there, I feel it. Oh, yeah. His muscles are jumping around a little, but we're just about done. Let's see if I can find it again. Shot?
On the last one?
Oh, yeah, well, one more after this. Just hold on, shot. What do you think? I'm a little low there? I just can't re-find the bone. There it is. Let's see what this is right here. Shot? That feels good right there. That looks perfect, doesn't it? But it's so abnormal because he's had all that surgery done, you know where. He whose name we shall not mention. Huh? Shot? He who's, what is it? Yeah, right. But no, we're not talking about Voldemort. We're talking about Bernardi. Bernardi. Shot? That's it. That's perfect. See where the tip of that is? That is literally the perfect spot. Show us, Jordan, the sacrum onto the S1 superior facet. Right where, that's right where the pain nerve lives. So I'm really hoping this does the trick for this gentleman. We're done. Now he came from where? Tennessee. So we had somebody from Tennessee. We had Boston, right? And the first patient was from New York. So we had New York, Boston, and Tennessee. We've got one more. She is from Florida. Yeah, 80% of our patients now come from out of state for these procedures because they know better. They don't want to go through invasive treatment that doesn't work.
We had a patient from Alaska, too.
Alaska. The first patient was Alaska. No? No. Oh, the first one was not mine. That was Patel. He's from New York. My first one was Alaska. And then we did...
Boston?
that guy was from Alaska. That's right. Boston, Alaska, New York, Tennessee, and Florida. All right. Well, I hope you enjoyed. I'll answer your questions. Type them up. I'll come talk to you.
The quote, by the way, came from National Enquirer.
National Enquirer?
Yeah.
There you go.
It also originally came from E.F. Hutton stockbrokers commercials in the 70s.
That's it, the E.F. Hutton stockbroker. That's where I heard it on TV. Inquiring minds want to know. All right, go ahead and play us a nice little testimonial, and I'll come answer questions.
I've been told by so many different doctors in so many different countries that either there's nothing they could do for me or that this is just my life now and I have to get used to it. You know, like, so when you came along and told me, like, oh, you don't have to live like this, it's like, well, everyone else says I do. So, like, I really didn't believe it. I was like, there's no way. Like, I've been told now for 5-6 years, like, this is it. You're never gonna play sports again. You're never gonna not be in pain again. Like, this is what you have to get used to. And so when I met you and when you were telling me, like, no, you don't have to do that, I was like, it's too good to be true.
Yeah.
There's no way. And then I woke up from the surgery yesterday and I wake up this morning and I just haven't stopped smiling because you were right. Everyone else was wrong.
Of course.
I feel great.
I'm Dr. Deuk, and it's June 28, 2023. I'm here with one of my lovely patients who traveled from Texas. She has been, as you've heard, suffering with back pain for a long time, years. You were telling me that you've traveled, talked to surgeons around the world, doctors around the world, and they've all told you you have to live with it.
Yeah.
That's your life. The truth is that used to be the way back pain was, but not anymore. Deuk Spine Institute has made a breakthrough discovery on not just how to cure back pain, but the causes of back pain. And because we now understand the exact source of back pain in every patient, we're able to treat that specific source. For you, you had the Deuk laser disc repair. You had 2 discs fixed yesterday. Before you came here, what was life like for you?
90% of my day is in bed, laying down. Pain for 5 years, pretty constant. Not doing any of the stuff that like made me me. Like no sports, no going out for dinners anymore because I couldn't sit for more than 5 minutes. Like I can't believe I'm sitting right now. Like it wasn't really much of how I wanted to live my life at all.
And it's not just you, but you're married, right?
Oh, my poor husband. I didn't take the trash out since 2018, which was like the one like nice thing, so I didn't have to take out the trash. But he had to do like everything for me. So it wasn't even just my life, and that was what was harder. Like he had to completely change his life. We used to travel, we used to play sports, we used to do stuff together. I got to sometimes watch movies with him if I could sit up to watch a movie, or he'd have to like get a weird angle so we could lay down and watch a movie on the ceiling together. He's an absolute trooper. He stayed with me like through all of it, never complained, but you know, like that's not what you want for your partner. That's what you don't want that for their life.
And can you imagine when he heard the news from these other doctors telling you you have to live your life like this for the rest of your life? Can you imagine how he felt? And he stuck around.
Yeah. No, I mean, like, I feel so lucky that I had a partner who was prepared to do that, but that only made me feel worse that I was making my partner do that, you know? Like, it's one thing for yourself to be going through the pain, but it's another thing to see how your pain really impacts all of those people around you. Like, my little brothers who used to see me as kind of this tough, can do anything for them, older sister, were taking care of me and carrying, like, my bags if I needed anything and had to pick stuff up for me. Like, my dad just every day worrying about me, and I was always the tough kid, like never had to worry about me at all. So it's just such a weird, uncomfortable, terrible paradigm shift.
Sitting here today, less than 24 hours after your Deuk laser disc repair, how much of that pain do you have?
None of it. I have none of it. I can't believe I had surgery yesterday. Like I just feel better than I ever thought I could feel again. Like I never thought in my life I'd get back to this point, so.
And this point being?
No pain. I don't have any pain. I can sit and my left leg hasn't gone numb on me. I can smile and have a conversation without the pain in the back of my head making me want to just lay down and not do anything. It's crazy.
And what would you say to the people out there living with back and leg pain?
You don't have to. Just call Dr. Deuk. Even if you're skeptical like I was, like call him, see what he has to say, explore the option, and just give yourself the gift of your life back.
Totally agree. One question, are you feeling this way because we've given you powerful narcotic painkillers?
No, I'm not on anything. I actually didn't even take the Tylenol extra strength. I 100% nothing. I had water and a little bit of coffee this morning. That's it.
And this is part of what's revolutionary with our technique at Deuk Spine Institute is curing pain in the back and neck, no hospitalization, outpatient. You went home an hour after your surgery.
Yeah.
And no painkillers afterwards. Because we're not doing trauma to your body during the surgery. The reason patients need pain medicine after surgery is because the surgeon is hurting their body with the surgery. Do you have any pain after the laser surgery?
None. I wasn't anticipating this at all. I have none. I feel fine. I don't feel fine. I feel great. It's really surreal still.
And you can see during your surgery, we made a tiny little 7 millimeter incision, tiny, 1/4 inch. And we did the whole surgery on those 2 discs with the laser, cleaning up. There was a lot of scar tissue at L5-S1, and there was not as much scar tissue, but you had a small tear at 4-5. And we were able to clean those tears up with the laser and get rid of your back pain. Congratulations.
Thank you.
Is there anything you want to say to your fans out there and your family?
Oh man, I can't wait to do stuff with all of them again. I can't wait to like go on trips and carry my own suitcase and hike and play sports. Not for 1 year,
Not
I
too
know.
soon.
Not too soon. No, it's all in the future. But just knowing that it is in my future again is like, it actually is life changing. So thank you.
You're welcome. Congratulations.
Thank you.
You're welcome. All right, let's get you guys out of here. When do you head back? Well, I hope you enjoyed that testimonial as much as I did. I just got through checking on our patients, and one of our patients who had the cervical is doing good. He is getting ready to be going home. He had general anesthesia, so his recovery takes a little longer. Anytime you have gas anesthesia with a tube down your throat, you're going to be several hours recovering. And then, of course, the patient that we did last, the cervical DPR, you guys didn't get to see that. We did that in room 2. He's already gone. He's from Alaska. He was doing very well. He had no pain. And then we just finished up this patient who basically, oh, I forgot to show all the cuts on his back.
Yeah. We got like the markers and all that. So.
Yeah, you should see. Actually, you know, it's not too late. I'll do it right now.
Hang on.
I got it.
Okay.
Can you turn off that? I don't know about. No, me. I'm going to do it.
Oh,
I'm going to show you.
Copy that. Okay.
Just use this camera right here.
Yeah.
I took pictures of his back yesterday. This is what it looks like.
Yeah. Here.
Look at that. Whoops.
Yeah.
That's his back.
Ugh.
Look at all those cuts. 16 surgeries. Shame. These are microdiscectomies, folks. That's why you don't want a microdiscectomy. Horrible, horrible surgery. Anyway, he's here because they all failed. And he still had back pain coming from the facets and the disc. We went in and fixed that with the laser. We did the plasma. Some people want to know, well, how do you do this plasma thing? Let me show you. If you look at the back of the spine, there are these nerves that basically all they do is, they're called pain nerves. They have a special name. It's called the medial branch of the dorsal ramus. You can actually see it right there. And that little nerve right there is what we're targeting and burning. Once you do that, you get rid of facet pain. All right, questions?
This first one comes from Jason after Jason, once more on YouTube.
Jason after Jason.
Asking, when fixing the discs, is the laser able to remove arthritic bone as well? My MRI shows both disc and bone issues.
Yeah, Jason after Jason, great question. Again, you guys are really misled as to what's important. You're all thinking completely wrong about the spine. Maybe you've been brainwashed, maybe you're just reading the wrong material, probably a combination of things. If you have an arthritic disc, leave it alone. The only time you want to treat a disc is if it's causing back pain or leg pain, weakness, numbness, tingling in your legs. Now, I say this, and you probably heard what you wanted to hear. The only time you treat it is when it's causing back pain, leg symptoms, right? Back pain, leg symptoms. The only time you treat it is when it's causing. Here's the problem. You, my friends, are not qualified to make the determination if that arthritic disc is causing your back pain or your leg symptoms. You see, if it were that easy, everyone would be making diagnosis and everybody would have the right treatment. And there would be nobody with back pain. You wouldn't have patients like this, would you? So, what does that tell you? The most important thing you need to understand is you cannot make a diagnosis as to what's causing your pain. I can. Henry cannot. Dr. Patel often cannot. 99% of the 100,000 spine surgeons in the world cannot. If there's 100,000 spine surgeons, 999, 95 cannot make the right diagnosis. So if they can't, and these are some of the smartest people in the world, what makes you think you can? The only way you're going to be able to make the diagnosis without me is if I build an AI platform that takes all my knowledge and understanding about back pain, puts it into that AI platform, and then I'm able to basically use that AI platform to diagnose your back pain. That's it. All right? I know this sounds like totally arrogant and Dr. Deuk such an asshole, but I swear to God, that is the God's honest truth in 2024. Now, fast forward 50 years from now, maybe then every doctor will be able to diagnose the cause of back pain. But today, they have no freaking clue what's causing your back pain. None. That's why they do shots, pills, surgeries that don't work, laminectomies, discectomies, fusions, artificial disc, cage device, barricade device, disc seal. The list goes on and on and on. There's 100 things. Why are there 100 surgeries? Why are there 100 surgeries for back pain? Because they don't work. Do you get it? Why is there one type of telecommunication device today? Because it's the best. And that's why everybody has it. It's called a cell phone. All right? There are satellite phones too, but satellite phones suck and they're very expensive. The reality is, folks, if there was everyone understanding why back pain is caused in somebody's back, there would be one treatment to fix it. The reality is there's not. There's hundreds of spine surgeries, and 99% of them don't work because they're not treating the right thing. So when I hear people say, can your procedure clear out my arthritis? Who gives a fuck? The reality is you're not interested in clearing out your arthritis. You're interested in getting out of pain. And if you're not interested in getting out of pain, well, then we shouldn't be talking, because we're here to get people out of pain. We're not here to make your spine look good on an MRI scan. Okay? If you want your spine to look good on an MRI scan, go to China. I'm sure you'll find some Chinese spine surgeon who will be happy to take a dead person's spine, cut your spine out, and put their spine in you. Okay? And then you can have about 7 days of your life that you can look at your spine and go, it's so pretty, but oh God, I feel like shit because I'm on all these drugs, immunosuppressive drugs, steroids, antibiotics, and you'll never get out of the hospital. All right? The only way to make your spine look normal is to take a normal spine from a dead person or a living person and move it into your spine. And I don't see too many living people lining up for that. Would you?
No.
No. So it's happening in China. They're taking cadaver spine, dead people's spines, and putting them in live people. And they have a nice, pretty looking disc. But then these people get sick and die. Why? Because you can't move tissue from one person into another without suppressing the recipient's immune system. It creates a huge problem. Anyway, here's the thing, all right? When I want advice about my eyes, because I wear contacts, I go to my optometrist and I ask him, what do I do? And you know what he does? He tells me what to do. And he's damn good. I know he's good because the results are good. I have contacts, I could see far, I could see close, I could use my phone. Point is, the proof is in the pudding, folks. Have you ever heard that saying? It means if you have consistently good results with something, then that's where you should go to get your thing done. When it comes to spine surgery, the surgery that has consistently good results for back pain is the surgery you just watched, the Deuk laser disc repair. Now, in this patient, he wasn't really here for back pain. He was here because his nerves were getting crushed by herniations. All right, so if you look here, you can see a herniated disc right there, and it's literally crushing the nerve. I went in transforaminal, and I got rid of it. Now, interlaminar means you're going between the lamina. There's a nice gap there. That's just in the model. In a real human being, it's closed off. You have to drill a hole here and make a space to get in there. And then you got to get off to the side and pull the nerve root over and then get to the herniation. That's why the transforaminal approach is the best. Safest, fastest, most efficient, least bleeding, no scar tissue, no pain, and the fastest recovery and the best results. Why do anything else? Okay? There is one back surgery that is the king of all back surgeries, and it is the endoscopic Deuk laser disc repair. There is nothing better. And I guarantee you, if money wasn't the issue, if every surgeon out there suddenly woke up tomorrow and they knew how to do the Deuk laser disc repair and they knew the results, they would not do any other surgery. They would not do microdiscectomy. They would not do laminectomy. They would not do, fusion surgery. I used to do 1,000 of these in my career. I don't do them anymore. I don't do them. I stopped doing them. Why? They're unnecessary. They hurt people more than they help. Okay? But they were the best we had before the Deuk laser disc repair. All right, next question.
This next question comes from Ram on Facebook, asking, how do you ensure that you have completely decompressed a nerve? Another way to ask this is how do you ensure the appropriate amount of herniated disc is removed?
Ram, I love your question. And I'm going to give you the answer. I cannot be sure. It's impossible. No doctor can be sure during surgery. There is only one way to be sure, and that is to do the surgery in an MRI scanner. Then you can take a piece of the herniation out and then get an MRI scan, take some more herniation out, get another MRI. And by the way, this is done with brain tumors. We have the ability to do that. It's called intraoperative MRI. And we take the tumor, we think we got it all, and then we put the patient in the MRI, scan their brain. Oh shoot, there's a little bit left to the right in the back. Let's go get it. All right? Here's the reality, okay? I have no way to know if I've gotten all the herniation. It's impossible. But no doctor can tell. None. So which procedure gives you the best view in that area to see if you got it? The answer is what we're doing, the endoscopic surgery. Why? Because you can see right there at the back of the disc. When you do a microdiscectomy, laminectomy, you cannot see the disc at all. You can't see the herniation, you can't see the tear, you can't see anything. All right? You're kind of sticking your instrument down in a hole hoping you got it. So the best surgery to see how much herniation is left is the endoscopic Deuk laser disc repair and any other transforaminal endoscopic surgery. All the other surgeries are far worse. So how do I know that I've gotten enough? Because I know the areas where the nerves get pinched. Okay, you see this here? This is called the neuroforamen. And when I come in here with my tube, all right, this is my tube, I go right into the herniation. I can see this whole area here with my tube. If you're coming in this way, ultrasonic or microdiscectomy, you can't see that herniation. The bone is blocking you. You understand? So the best surgery in the world for seeing how much herniation you've gotten rid of is the surgery we just did, endoscopic. All the others are terrible, but my experience tells me when I've taken enough herniation out from that area. And the way I gauge it is when I see my patients after surgery, I examine them the next day and I talk to them and I get information from them. So on the exam, what I'd like to see is, of course, their leg pain's gone. They no longer have sciatic pain. Their numbness is getting better. And then when I check their strength in their foot or leg, I see some improvement, okay? If I can see that, I know I've decompressed the nerve roots. So it's really more than an MRI intraoperative, more than looking around, it's experience and it's the post-operative interview with the patient the next day that gives me the most information. Now, that said, I've been doing this for 26 years, so I know what to look for on the exam the next day. I know what to look for on the history. I can tell if I did a good job. And I've done thousands of these surgeries, thousands. So when you're done thousands and you have every single time a good result, then you know, okay, I need this during surgery to get good result afterwards. And basically, it's experience. You need a surgeon who cares about the results and wants the best result for the patient. And that's what we do at Deuk Spine.
And last but not least, this comes from John on YouTube saying...
But not Big John.
Not Big John. John said, at the advice of my healthcare provider, I had a SES implanted
Ugh.
after a good trial, but the SES isn't taking care of my numbness in my feet and legs. Could I still be a candidate to help? The actual pain is handled better than without the stimulator. I have lateral recess stenosis due to arthritis and thickened ligamentum flavum. Ligamentum flavum at L4-5 and L2-S1,
Yep.
according to my MRI and orthopedic. But my feet and legs still go numb, and my toes are pretty awful and awful like they are wrapped with.
Who is this?
John. John Hill.
Hey, John. John on
YouTube.
John, thanks for writing in. The short answer to your question is yes, we can help you with the laser surgery. How do I know? Okay, the reason I know is because the numbness you're describing, the way you're describing it, tells me the nerve is still getting pinched. And the fact that it gets better then gets worse with certain movements means it's mechanical, means there's a pinching going on. That's what we can fix with the laser surgery. So my advice to you is, if you have an MRI, hopefully you have an MRI compatible spinal cord stimulator, you can get an MRI. But if you have one in the last year, send it in through our free MRI review website. It's mri.deukspine.com. Henry will post a link if he hasn't already. Fill out the form, send us the DICOM images by CD, FedEx, UPS, or upload, or give us your login credentials and a link. That said, when I have your MRI pictures, we have the report, we have your form you filled out, we'll do a free MRI review. I will tell you exactly what needs to be done to fix your symptoms. And then you can actually probably get rid of your spinal cord stimulator.
And that is it for questions.
Thanks for joining us. This was a long case and a lot of really good questions. I'm Dr. Deuk Machen. We're going to be doing one more surgery. She's a bilateral L4-5 and a right L3-4 Deuk laser disc repair. She's got pretty good bulge on both sides at L4-5 and right side at L3-4. She's got a lot of back pain. But I'm going to tell you this right now. I saw her yesterday. She's from Florida. She's down south. She has literally 10 causes of back pain. We're fixing 2 discs. That's only 2 out of 10. She still has 8 more causes. And I didn't know about all of them until I examined her yesterday, and I told her all about them. She's going to get these 2 discs fixed, and then we're going to fix some more stuff in the future. Point is, and you guys need to understand this, everyone thinks they have one thing causing their problem. A lot of times it's 2 or 3 or 4. The average is 4. Okay? So keep that in mind when you see your doctor. You probably have more than one thing causing your back pain. All of the things have to be addressed, whatever the sources are. Our new website, which is launching in February, is going to have a really nice diagram, interactive, that's going to teach the user what are those 30 causes of back pain. So you'll be able to literally play with this beautiful animation that I've created that shows you where all those sources of pain are. Okay? And then you can understand it better. Thank you, Henry. Henry's done a great job. And if you want to join us, we'll be going back to surgery in about 30 minutes.